Every other healthcare experience has trained you to believe that longer means better. 60 minutes of physical therapy, 45 minutes of occupational therapy, long sessions, lots of hands-on work. And so when a parent watches their child get a chiropractic adjustment that lasts maybe 90 seconds or 2 minutes at the most, the natural thought is, wait, what's this? And honestly, that's the right question to ask. But the answer flips what most of us have been taught about healing. A neurologically focused adjustment is not short because it's doing less. It's short because the nervous system responds very powerfully to precise input. And for a child whose system is already overloaded, more input is not always better. Sometimes more input is exactly what pushes them further into overwhelm. So today I want to explain what is actually happening during a chiropractic adjustment, why pediatric adjustments are so gentle and so short, and why frequency matters more than time on the table. First, an adjustment is probably not what most people think it is. The pop or crack is not the adjustment. That sound is simply gas releasing from the joint capsule. It does not tell us whether the adjustment worked, and it's not the goal, especially with children. The real action is neurological. When we give a specific adjustment, we are giving the brain a clean, precise signal through the spine. That signal activates receptors in the muscles and joints, especially mechanoreceptors and proprioceptors. These receptors tell the brain where the body is in space, how much tension is present, and how the system is functioning. Those signals travel up the spinal cord into the brainstem, the cerebellum, and the cortex. In other words, one small input at the spine can change how the brain is reading and regulating the body. That's why we are not just chasing posture, pain, or symptoms. We're looking for subluxation, which is a pattern that includes physical stress, joint fixation, and neurological interference between the brain and the body. And with children, the pressure is very gentle. I always tell parents it's similar to checking the ripeness of a tomato. Gentle, specific, and appropriate for the child's age and nervous system. One of the clearest examples of this was documented in a level 3 NICU. A newborn baby boy had experienced a traumatic birth, including a whiplash-type injury to his upper neck and brainstem, a hypoxic brain injury, and PPHN, which is persistent pulmonary hypertension of the newborn. Because he was in the NICU, he was connected to monitors that showed exactly what was happening in real time. After gentle chiropractic adjustments, his heart rate came down, his respiration improved, his oxygen levels rose, his whole body softened and relaxed. That story is powerful because it lets us see on monitors what is happening more quietly in our office every day. The adjustment is not forcing the body to do something. It is giving the nervous system the input it needs so the body can regulate better. This matters because the brainstem controls many of the foundational systems your child depends on every minute of the day. Heart rate, breathing, digestion, arousal, sleep, and the stress response. When the nervous system is stuck in sympathetic dominance, which is fight or flight mode, the body is constantly bracing. Many of the kids we see are living there. Their systems are overloaded by school, screens, sensory input, food sensitivities, poor sleep, stress, and constant demands. So when we adjust, we are not trying to add more stimulation. We are trying to give the body the right input so it can shift out of survival mode and back toward regulation. This is also why one adjustment can affect things that seem unrelated. Parents may notice changes in sleep, digestion, emotional regulation, immune function, focus, or recovery. Those things are not separate systems. The nervous system is coordinating all of them. A 2016 study published in Neuroplasticity showed that chiropractic adjustments can create measurable changes in the prefrontal cortex activity. That's the part of the brain involved in executive function, attention, and regulation. So again, we are not talking about something random or purely structural. We're talking about brain-body communication. That's why children with very different diagnoses still respond to the same foundational care. One child may have ADHD, another may have sensory processing challenges, another may have anxiety or constipation, sleep issues or immune struggles. The labels may be different, but underneath many of these children, they share a pattern of dysautonomia, meaning the autonomic nervous system is not regulating the way it should. Now, let's talk about why pediatric adjustments are short by design. A child's nervous system can only absorb so much input before it becomes overwhelmed. I often describe it like a computer with too many tabs open. When too many programs are running at once, the whole system slows down or crashes. That's what happens in a dysregulated child. Their nervous system is already working overtime. So giving them 30 or 60 minutes of hands-on input is not automatically more thorough. For some kids, it can trigger the same crash or meltdown that parents see after a long therapy session, a dental visit, or a stressful day at school. The adjustment itself may only take a couple of minutes, but the brain continues processing that input for the next 24 to 72 hours. That's when the deeper work happens. The adjustment is the catalyst. The nervous system does the healing between visits, and that brings us to frequency. The brain rewires through neuroplasticity, and neuroplasticity depends on repetition. It's not about how long one session lasts. It's about giving the brain the right input in the right place consistently enough for the pattern to change. There are 168 hours in a week. If a child comes in 2 or 3 times a week, they may only receive about 6 minutes of actual table time. But the real question is what happens during the other 167 hours and 54 minutes? Are they holding the adjustment? Are they adapting better? Are they sleeping better? Are they recovering faster? Are they staying ahead of the stress, growth spurts, illnesses, and sensory overload that keep reloading the system? That's why frequency matters so much, especially in the beginning. We're trying to help the nervous system release stress faster than life keeps adding it back in. And this is where our insight scans are so important. We don't want to guess what your child's nervous system is doing. We want to measure it. HRV helps us see adaptability in vagal tone. SCMG shows us whether the body is stuck on the gas pedal or moving into fatigue patterns. Thermal scanning shows us where autonomic dysregulation is concentrated along the spine. 2 children may have the same diagnosis and completely different scan patterns. That's why care has to be personalized at the neurological level, not just based on symptoms. So when parents ask, can a 2-minute adjustment really make a difference? The answer is yes, when it is specific, neurologically focused, and repeated at the right frequency. Your child doesn't need more labels. They need answers. They need us to look at the foundation. So if your child's been through every protocol, every supplement, and every therapy, and you still feel like something deeper is being missed, it might be time to look at the nervous system. Get the scans, find the foundation, and trust the frequency. To get started with neurologically focused chiropractic care, click the link in our bio, send us a message, or schedule directly with our team at Harmonized Neurology in Williamsburg, Virginia.